Mike here from Leverage Chiropractic Physical Therapy, and in this video we're going to be going over a stretch or a release, more so for the quadratus lumborum. It's a muscle of the low back that gets very, very tight, and it could be leading to a bunch of your low back problems. It's a pretty short muscle right along this flank area that's really used for lateral flexion, and when they both contract, helps extend a little bit. And these get really, really tight because they try and hold everything together, especially if you're not really using the pelvis as much and you're kind of relying on that low back a little bit too much. So to get this one done, we're going to need some type of ball, pretty firm. I'm using kind of like a jug softball, pitching machine ball. You can really use a softball, any type of ball that's got a little bit more firmness than a tennis ball itself. So for the setup for this one, we're going to lay on our backs and we're going to place the ball right in that flank area. So right above the pelvic bone, but below the ribs. You don't want to be on a bone because that'll make it very tender. And it's really just a simple kind of release. Not too big of a movement, but you're just going to lay back, place the ball in that area, more off to the side. You're going to bring the knees up, and then first you're just going to relax on it. If it's really tight, give it a couple of good breaths. Try and really sink into that, let it relax before you start it. You don't want to do it when it's in like a guarded position. From here, all you're going to do is you're going to lean the legs towards the side that the ball's on, and it's going to kind of push that muscle in towards the spine. Just kind of floss that back and forth a few times, spending up to about a minute to 2 minutes in the position. Just kind of really trying to get a good stretch and release on that muscle. And you'll feel some pressure. We always follow two basic rules when we're doing this one. Never goes above 3 out of 10 on a pain scale. So if it is, decrease that tension or that pressure a little bit to fall more under that 3 out of the 10 scale. And then being able to breathe the whole time. If you find yourself catching your breath while you're going through it, might be a little bit too intense, back off the pressure a little bit and give that one a shot. Should help out with that low back pain if it is the cause of it.